All month long, as part of Black History Month, we have highlighted important stories, people, and issues impacting the Black community. And this morning, we're looking into the continued rise in the number of Black women dying from pregnancy complications.
And ABC Action News reporter Larissa Scott joining us now live in the studio with more on the local effort, Larissa, to improve Black maternal health.
Yeah, that's right, James. The CDC says most of these deaths are preventable. And while raising awareness is very important, local experts tell me it's now time for some actual change.
Despite the conversations having been had, we do see that this disparity is widening and that the U.S. maternal mortality is increasingly getting worse.
Dr. Alyssa Brown oversees USF's obstetrics and gynecology residency program and TGH's OBGYN department. She's actively working to improve inequities within healthcare. She says these disparities have been persistent for decades.
I think the most glaring or jarring example would be with Black maternal morbidity.
Each year in the United States, hundreds of people die during pregnancy or shortly after. And according to the CDC, Black women are 3 times more likely to die from pregnancy-related causes than white women.
I think a large part of it has to do with up to 50% of someone's health outcomes has to do with what we don't traditionally think of as medical things.
Those include social or economic factors or the physical environment someone lives in, known as the social determinants of health.
We know that Black women and other women of color are traditionally marginalized communities in this country. And so those conditions that we see Black women working, living, raising their children in can contribute to poor outcomes.
Recently, there's been an increased effort across Tampa Bay to improve the statistics. Experts say that includes raising awareness, making sure we have a more diversified workforce in our hospitals, and improving access and resources.
So there is a lot of grassroots efforts. There's a lot of larger efforts that are happening.
I had to prioritize my pain.
Xaviera Bell organizes town halls to raise awareness on this issue that she's unfortunately experienced firsthand. She tells us her concerns weren't taken seriously when she was pregnant.
So by the time I got to the doctor, I was actually in preterm labor and I was forced to have my son, so we had to watch him die.
While there's still a lot of work to do, health officials tell us they're hopeful for the future.
That there is a lot of good work happening. There are like-minded physicians like myself who dedicate a significant amount of their time to studying this and to improving the care that we deliver to Black women.
Now, in the meantime, experts encourage people to advocate for their own health and find doctors that they feel comfortable with. For more, head to abcactionnews.com.